Welcome back, viewers. Thank you so much for tuning in. My name is Patrick Tawayama Tope, and on this channel, I do deliver content on social work, specifically practice with children and families, because that's what I do on a daily basis. And in today's video, I'm just going to talk a little bit about professional anxiety in social work, especially practice with children and families. The way I'm going to be delivering today's topic is I'm just going to talk a little bit about how professional anxiety manifests in social work. I'm going to break it down into emotional, science, cognitive science, behavioral science, and also physical science. And then I'm going to talk a little bit about the impact of that professional anxiety on practice and the outcomes of a social worker. And I'll also talk about what are the factors that contribute to a professional having anxiety. Where is all this coming from? And then lastly, I'll also touch a little bit on how social workers can overcome professional anxiety and build some resilience, and how organizations can also support professionals in terms of reducing this anxiety. And then that will be the last, in this video. Those are the 4 parts I'm going to deliver the video in today. So let's talk about professional anxiety. It's quite common, yet this is a phenomenon which is often overlooked in organizations or in teams. But however, it's quite a challenge for social workers really working with children and families. It arises mainly from the high-stakes nature of the profession that we are in. I mean, high stakes nature in the sense that we're always in the media, we're always under scrutiny from from managers, we're also always under scrutiny from directors, for example. We're also always under scrutiny from the parents that we work with. We're also under scrutiny from the children that we work with, and there's always a fear of failure. So this actually leads to professional anxiety. And on the other hand as well, we also need to look into the fact that the complexity of the cases that we deal with also brings some anxiety in us, because sometimes you come up with this complex case that you don't even know what to do about. Not only you yourself, but sometimes your manager also is struggling on knowing exactly what needs to be done with that particular case. So professional anxiety is something which is real and it's there. And the last thing I'm going to talk about, which leads to professional anxiety as well, is the pressure to make sound decisions in a limited amount of time. That puts so much pressure on us as professionals, and it also leads to anxiety, which can significantly impact on the professional, but also impact on the child and the family that you are working with. We are going to unpack all that in this video today. So how does professional anxiety manifest in social work, especially when you are practicing with children and families? I spoke about the emotional signs. What are the emotional signs? I'm talking about constant worry. I spoke about constant worry already. We're talking about constant worry about making the wrong decision or missing the signs of harm, especially when you talk about physical abuse or sexual abuse or a criminal exploitation or a child, sexual exploitation and all that. Sometimes the emotional signs can also be feeling overwhelmed, by the complex or the high risk cases that we are carrying. And sometimes it also manifests in the experience, when one experiences fear of failure or making a serious mistake. And sometimes you feel so defensive when questioned by a manager or other professionals, or another professional who is taking over a case from you questions you one thing. You feel so defensive. That's one other emotional sign of showing that you are professionally anxious as a professional. So in terms of the cognitive signs, I'm talking about overthinking. There's always a situation where sometimes even weekends, you start to think about that case. You start to think about that child that you went into that particular household and you saw that household looking like, a pile of rubbish all over and all that. So you always start to overthink about cases and decisions, and sometimes it leads you to doubt your own professional judgment. That's how it affects you cognitively. You may also have difficulty in processing information and maintaining focus. Why do you struggle to maintain focus? Only because sometimes your focus is on that one particular case that you feel is high risk more than the other ones. So that's how it affects you also cognitively. And there's also what we call catastrophic thinking, where you assume the worst case scenario will happen, even though it may not happen. But as a professional, we are always thinking, the way those parents do drink alcohol, I might just wake up one day hearing that the house burnt and something terrible may have happened. Or sometimes you may think, because of poor supervision for that particular child that I'm working with, something bad is going to happen. So you always have this catastrophic thinking of something catastrophic is going to happen to that particular child, for example. That's how it affects you cognitively. The last thing, or the last way it may affect you cognitively, would be your inability to make decisions due to paralysis by analysis. So you analyze too much to an extent that you struggle to make a decision. That's what we call paralysis by analysis. You need to be taking it all in, and I'm gonna put the notes in the in the description section below. So let's explore how it affects you behaviorally. In terms of behaviorally, it might lead you to avoid difficult conversations with families and other professionals. That's how professional anxiety can manifest in your day-to-day work. Sometimes it can lead you to have increased absenteeism from work, frequently taking sick leave. That's professional anxiety, which might be creeping in sometimes, or sometimes over-reliance on checklists, only because you feel or your mind doesn't take it all in terms of the steps that you need to be. There are some things that okay, if a child comes into care, I should be able to do A, B, C, and D. But because of professional anxiety, sometimes you over rely on checklists, making sure that I've done everything according to the checklist. For example, sometimes following procedures rigid, in a rigid manner, and in all doing that, you're actually forgetting the child, who should be at the center of everything that you're actually doing, and in terms of your professional judgment as well. Last but not least, under behavioral science, is being overly compliant with management to avoid criticism, even though it actually sometimes you need to be a professional and make your own judgments about what's going on. But sometimes you end up aligning to what the manager's expectation is, not necessarily being focused on your own judgment and decision as the worker who is actually working that particular case, only because you don't like to be criticized, or sometimes you don't want to be seen as a failure. Right, in terms of the physical signs, this is now the important stuff. We are talking about sleep disturbances. Professional anxiety can cause you sleep disturbances, or you can even have trouble falling asleep or staying asleep, or you can even have trouble to wake up, for example. Sometimes those things actually happen. Sometimes you might have constant headaches, muscle tension, fatigue, or increased heart rate, sometimes shortness of breath, or high pressure situations, especially in high pressure situations, sorry. And sometimes it can also lead to digestive issues, which can be linked to chronic stress. For example, IBS is something that can also manifest as a physical sign of professional anxiety. So you need to be mindful about that. And then I'm moving on to the next section, where I'm going to be talking about the impact of professional anxiety on practice and outcomes for the practitioner. So for the practitioner, the impact it is, we spoke about how it impacts you on as a practitioner, as an individual, but we're also looking at how it impacts on your practice. We are talking of reduced confidence in decision making, confidence in you now making you actually second guess your each and every decision. You end up second guessing your decisions. That's how it impacts on your professional practice, on your practice. Sorry. And also, I'm talking about burnout and compassion fatigue. Chronic stress can lead to emotional exhaustion. Compassion fatigue is where people in helping professions come to a point where you can't just do it anymore, only because we operate like batteries, isn't it? When a battery is depleted, it is nothing else to offer. It is nothing else to give. That's how I equate compassion fatigue to. In as much as you are there to help others, but you need to be mindful that chronic stress can also lead to emotional exhaustion. You can become depleted. So it's important for you to be taking annual leave. We'll talk about that in a minute as well. Emotional detachment, where sometimes to protect yourself as a practitioner from the stress, you may become emotionally distant from the families that you're working with. You become emotionally detached from the families that you're working with. Instead of seeing them as individuals, you start seeing them as numbers, saying, I've got 20 families, or I've got 20 children that I'm working with. I'm going to click over 10 to you very soon. I'm going to click over 6 over to you very soon. So there is that emotional detachment that comes, where you then cloud your judgment from from what it's supposed to be like, and in a way you're actually trying to protect yourself from professional anxiety. And then impaired decision making, that's another thing, or that's another impact it has on our practice. What do I mean by that? I'm saying anxiety can cause social workers to avoid making decisions, or sometimes it can make them to be reactive rather than to be proactive. You become more reactive rather than to make considered choices at the end of the day, or considered decisions, or considered recommendations at the end of the day. You become more reactive. That's how it can also impact on you. So let's talk about how it impacts on the children and families that you're working with. We are talking about inconsistent decision making to an extent that anxiety may lead to either overly cautious or overly lenient approaches to the families that you are working with. Sometimes, because you are professionally anxious or you are risk averse, sometimes it may lead you to either be overly cautious, or sometimes you can be overly lenient, or you might be overly optimistic to an extent that you actually overlook some of the things that you need to be looking into, but you overlook them because you are so anxious that you just want it done, get away with, close it, and then move on to the next one. Right. Another important thing to take note of in terms of how it impacts children and families is reduce the relationship quality that you as a professional have with the family. Because anxious professionals may struggle to build trust with families. So it may actually reduce your relationship, the quality of your relationship with the families that you're working with, or the children that you're working with. Or there is also increased likelihood of missed risks or missed opportunities. So anxiety can prevent effective risk management or effective risk assessment and timely intervention. That's self-explanatory. I'm not going to touch that anymore. And then the last one is delayed case progression. Sometimes you delay because you are afraid of making a wrong decision, so you delay having to pass on that case to the next team, or to actually progress what needs to be done, because you are anxious on making decisions. You are not clear on what decision to be recommending on that particular case. So what may help in that situation is to make sure that you can have a conversation with your line manager, or a conversation with a colleague that you think may know well exactly what may need to be done in that particular case. And that way it will actually help you to make that decisions, because by not doing that, it can actually lead to drift and delay for that particular case. So what factors do contribute to professional anxiety? I'm talking about high caseloads. They do contribute to anxiety, professional anxiety. When it is quite overwhelming, when the workload is quite overwhelming, it increases pressure on you as an individual to progress that work and also to make decisions on that particular caseload. So that increases your professional anxiety. Public and media scrutiny, I spoke about this earlier on, because high profile child protection cases sometimes they leads to fear of blame, and fear of making mistakes and all that, because of the fact that we're always under public and media scrutiny. So that also increases professional anxiety as well, especially when you know that the case that you're dealing with may attract some media attention. It just puts that professional anxiety over the roof, so to speak. And then sometimes lack of supervision and support may also lead to anxiety, because your decision making may be lacking, because you don't have that complete oversight of a manager who is telling you, or who is giving you, who is rubber stamping your decisions. Because sometimes, even though you may know what needs to be done, but you just need somebody to say, okay, yes, that's okay, Patrick, we can proceed like that. Even myself, sometimes, even if I'm confident about what I'm doing, I always check it out with the manager to say, this is what I was thinking. Am I okay to proceed like that? And then they will say, okay, fine, go ahead. Or they will fine tune and say, you were supposed to do A, B, C, and D. And then the complexity of the cases that we are dealing with as well leads to professional anxiety. I'm not going to talk much, because obviously, for example, if we're talking about the toxic trio, where there's cases involving domestic abuse, substance misuse, and mental health, sometimes it heightens the stress, because they are talking of the toxic trio, all three of the most riskiest factors that you can think of are actually involved in that particular case. Then that puts your professional anxiety over the roof as well. And then if there are legal and procedural issues which are going on, if a case is going to be going to court, obviously your anxiety is going to go over the roof. And when there is an organizational culture of blame, then that can also increase your anxiety. Right, so let's move on to the last segment of my video today, segment number 4, where we are going to be talking about how, as a social worker, you can overcome professional anxiety. You need to be building your professional confidence. How do you do this? Attend training, strengthen your knowledge base, and strengthen your skills base. Even if it means you need to be going on a joint visit with somebody else so that you can strengthen your skill base in engaging those families, please do that. You also need to use your reflective practice, use your group supervisions to reflect on your own practice so that you learn from it. And you also need to develop some professional resilience. How do you do that? Focus on your personal strength and previous successful outcomes, and think about those previous successful outcomes, how you managed in that situation, and make use of those skills that you used in that particular case to manage the current scenario or the current situation that you are in. So that's number 1. Point number 2 is about improving decision making confidence. You need to improve your confidence in decision making. How do you do that? Use structured frameworks. Use your right time, right help guidance. It helps you in making decisions and recommend the right level of support for that particular family. For example, you need to be relying on models. For example, we're talking of signs of safety, strength-based approach, relational practice, and connected, connections count. For example, you make use of all those models to mold your practice towards that as well. It helps you to actually break down what's going on, what's working on, what's not, and all that, and you'll be able to frame your decision making around that as well. And you need to balance evidence with your own intuition. What is your own intuition telling you, but what is evidence telling you? And then you are able to actually recommend the best course of action for that particular family. And you also need to seek peer consultation. That's how you can also improve your decision making confidence. And then the other point, point number 3, in terms of how you can improve as a practitioner, is to establish effective supervision and support. Make effective use of your supervision space, and go to that supervision with an agenda of what you need to be discussing. Go to that supervision with a few cases that you want to be. Prioritize those cases, get them done, thrash them out with your manager, and come to an agreement of actions that needs to be done, things that needs to be done, so that you'll be able to progress accordingly. Because sometimes you actually stagnate a case only because you don't know what to do. But if you receive regular supervision, you make use of your 10-day supervision. If you're in an assessment team, make use of those 10-day supervision, because it gives you direction of what you need to be doing. And then after that, you are then just boom boom, get your work done, off you go, pass it on to somebody else, or whatever it is that needs to be done. If it's shutting down, shut it down as well. You need to be ensuring that you've got regular supervision, discuss the difficult cases and emotional responses in a safe space so that you'll be able to get the support that you need. Encourage a learning culture in your team so that you are also the one to be presenting to your team and get the feedback from them as well, because that's how you can access peer support, if you're working in a team. And you also need to manage your workload and time effectively. The era and time of you not being able to prioritize your cases, the era and time of you not being able to set realistic goals, or the era and time of you not taking breaks from your work is not now. You need to be able to take your breaks, set realistic goals, and be able to prioritize your work. When I talk about taking breaks, I'm not talking about taking 2-hour breaks. I'm talking about taking a necessary break, the necessary break that you need to be able to recharge yourself and go back and do what you need to do, rather than spend time having chit chat. You make use of that time to get on with your work and make sure that you actually get on with your work. All right, you also need to build some emotional regulation skills. How do you do this? Use mindful techniques. If you are good in yoga, make use of that. If you're also good in debriefing difficult cases with a colleague, if you've gone on a visit, call a colleague, have a conversation, or call a manager, have a conversation, or maintain a work, or also you need to be able to maintain a good work-life balance. I'm not going to emphasize on that because that's quite clear and straightforward. And you also need to be strengthening your relationship with the families. How do you do this? Be transparent and build trust through consistency. Be very consistent with them, and don't promise things that you can't deliver. Don't promise things that you know it's not your call to make that call. Don't promise things to say, I'm going to give you a £50 voucher, when you know that you need to go to your manager to actually access that voucher. If your manager says no, what are you going to do? Are you going to use your own money from your pocket? So don't overpromise things that you know you can't deliver. And you also need to be developing some professional curiosity as well, and some emotional intelligence. How do you do this? Challenge your own biases and your own assumptions. You also need to be seeking to understand the family dynamics of the families that you're working with. You also need to be understanding the underlying reasons of why this case is actually open to the team, and also in the underlying reasons for the parental behaviors that you are seeing. Is it due to the ACEs that they suffered? Is it due to generational trauma? Is it due to substance misuse? Is it due to shame? Is it due to cultural issues? There could be lots of other things which could be going on there. So you need to be seeking to understand the underlying causes of the things that you're actually seeing. And you also need to be separating your emotional responses from professional judgment. And if you are going to make a professional judgment, let it be a professional judgment based on evidence, based on your analysis of what is going on, rather than mixing your emotional responses with emotional judgments. It doesn't work like that. And then when it comes to how organizations can also support professionals to reduce anxiety, or support staff to reduce professional anxiety, we are talking about practice forums. Let's have practice forums. Structured supervision support systems needs to be in place. Manageable caseloads. Sometimes we need to be thinking about what kind of CAP we need our social workers to be working with, so that they can actually be efficient and also be effective out there. Manageable caseloads will lead to social workers being able to administratively work their cases in a good manner and be able to have good outcomes. You also need to be a trauma-informed workplace as an organization. We need to be encouraging professional development, and also maintaining what we call promotion from within, where instead of hiring from outside, you need to be thinking about, okay, we have got Lorna in team A who is quite good in this. We can actually promote Lorna to be doing this fantastic piece of work. We've got Worker B who is in team whatever. We can actually promote Worker B to be doing this and that and that. So with those few nuggets, I hope you've grasped something around professional anxiety, and I'm going to put it in the description below, so that I'm going to put my notes in the description below, so that you'll be able to grab and learn from that as well. Thank you so much for watching. If you haven't subscribed, please do subscribe, hit the notification bell, so that when I post, you'll be the first person to know. I really appreciate you watching, and I really appreciate you listening to me for these few 20 minutes. Thank you so much. Bye bye.